Welcome. This is Selecting a Supportive Birth Team to help you achieve your breastfeeding goals. My name is Denise Horge and I'm the owner and operator of Mother's Magical Milk. At the time of this recording, I'm a certified lactation counselor pursuing my international lactation license. I am excited to partner with the Fort Worth Moms and their Virtual Bloom 2021 to bring you this workshop. As a certified lactation counselor and breastfeeding mother of two, I understand both the frustration and beauty of breastfeeding. I launched Mother's Magical Milk to help mothers achieve their breastfeeding goals. I am currently pursuing my international lactation license. My philosophy is to couple science and evidence-based research together with my experience to deliver customized support to my clients. I work tirelessly in the community to raise awareness, to normalize breastfeeding, and advocating for breastfeeding rights. I will continue to educate parents and instill confidence in breastfeeding mothers. If we talk about breastfeeding in ancient times, breastfeeding is the original way to feed our children. While it's natural, breastfeeding is not always intuitive. In ancient times, new mothers were surrounded by other mothers, aunties, grandmothers, etc. As we fast forward to modern times, the absence of tradition equates to a lack of education, resources, and support. Hence, this was the motivating factor behind Mother's Magical Milk. These are our learning objectives for today's workshop. Seeking and establishing a breastfeeding-friendly birth team will most definitely aid in achieving your breastfeeding goals. I would like to remind you of all the magical benefits of breastfeeding. We're going to talk a little bit about the history of the Baby-Friendly Hospital Initiative and what it means to breastfeeding. We will touch on breastfeeding topics to include in your birth plan, strategies to engage your postpartum support team, and close out with a few back to school, back to work rights you should be aware of. All right, let's dive right in. Congratulations! Regardless of what your breastfeeding goals look like, i.e. exclusively pumping or exclusively breastfeeding for the first 6 months, congratulations on your decision. Your decision to breastfeed your child has benefits to both you and baby. Let's briefly discuss just how magical breast milk truly is. Colostrum, also known as your first milk, is the thicker, sometimes slightly yellow substance that is produced while you are still pregnant. Colostrum is crucial to good infant gut health as it lines and seals your baby's stomach, allowing for healthy bacteria and supporting the gut's microbiome. When the placenta is expelled or delivered from your body, the levels of estrogen and progesterone drop, causing prolactin levels to increase, and this further signals breast milk production. Breast milk is comprised of fats, carbohydrates, sugars, and other substances specifically geared towards human growth and development. The levels and energy content of these ingredients change throughout a feeding, the day, and your breastfeeding journey. For example, the concentration of melatonin in human breast milk, which helps baby to sleep, varies throughout the day. Breast milk changes over time, giving your baby exactly what it needs as it grows. Breast milk also allows antibodies from the mother to flow to the child. Breast milk is truly magical. The magical benefits of breast milk especially benefit mom in a magical way. There are several benefits to the breastfeeding mother. I have captured some of those benefits here on this slide. You can expect less occurrences of gynecological and premenopausal cancers, less instances of osteoporosis, and less reports of postpartum depression from breastfeeding mothers have been reported. Less instances of metabolic diseases, which include diabetes and high blood pressure. For heart disease complications, as much as 14% reduction has been shown, and a 34% reduction in heart disease-related deaths to breastfeeding mothers. This is significant in African American women as we lead the country in deaths related to heart disease. So breastfeeding is an important step in the right direction for good heart health. Of course, baby receives magical benefits as well. Breastfeeding protects against ear, throat, and sinus infections well beyond infancy. Breastfeeding also protects against allergies and eczema. The unique ingredients in breast milk aid in less occurrences of upset stomach, diarrhea, and constipation when compared to babies who exclusively are fed formula. There are also less instances of SIDS, which is sudden infant death syndrome. Remember, a baby and mother are together. This way mom can observe baby feeding cues. As baby grows into childhood and adolescence, there are less occurrences of diabetes and childhood obesity in breastfed children. Now that I've reminded everyone of some of the magical properties of breast milk, let's talk about hospitals that are breastfeeding friendly for those planning to deliver at a hospital. The Healthy People Goals were established in the late 1970s and designed to run for 10 years. Each decade, those initiatives aim to address the country's most pressing public health issues. The first set of goals were not specific to breastfeeding, but by the second iteration, breastfeeding goals were included. Following a call to action to support breastfeeding by the Attorney General in the early 2010s, the goals for breastfeeding were increased to 82% ever breastfed, which means breastfeeding was at the very least initiated, 61% still breastfed at age 6 months, and then 34% still being breastfed at the 1-year mark. This is significant because to achieve 82% of babies in the U.S. being ever breastfed, there needed to be a drastic change in hospital policy, training for birth workers, and some type of regulation on formula companies' marketing practices. Historically, the U.S. has not done a great job in breastfeeding resources, education, and support. The Baby-Friendly Hospital Initiative was launched by the World Health Organization and UNICEF in 1991. The U.S. initially voted against implementation. According to the Baby-Friendly USA, in 2019, more than 28% of births and more than 600 baby-friendly designated facilities occurred. That number is on the rise. However, there is still much work to do. Thankfully, baby-friendly hospitals can be found in all 50 states, the District of Columbia, and Puerto Rico. These 10 steps listed here on this slide were developed by a team of global experts and consist of evidence-based practices that have been shown to increase breastfeeding initiation and duration. Baby-friendly hospitals and birthing facilities must adhere to these 10 steps to receive and retain that baby-friendly designation. To find out if your hospital of choice is designated as a part of the Baby-Friendly Hospital Initiative, visit www.babyfriendlyusa.org to view their interactive map. Let's spend some time touching on each one of these. So, a hospital must have a written policy that is communicated to all staff, and that staff must be trained on the policy. They must have a program or some type of system to educate pregnant women about the benefits as well as the management of breastfeeding. They should help mothers initiate breastfeeding within 1 hour. Again, this goes back to that skin to skin. Healthcare professionals should assess and demonstrate appropriate positioning and latch. They should not give infants any other food or drink unless medically indicated. Encourage rooming in, that way mom can observe baby's feeding cues. Encourage demanding breastfeeding on demand. Not giving pacifiers or artificial nipples. Again, this is in the general sense, unless medically indicated otherwise. And establishing hospital breastfeeding support and referring to community-based support for breastfeeding mothers upon discharge. Once you have established where you intend to deliver, be sure to include breastfeeding as part of your birth plan. Regardless if you plan to deliver at home, a hospital, or in a birthing center, these strategies will help you achieve your breastfeeding goals. So number 1, consider hiring a doula or a birth coach. Note, this is not your mate. This frees up your mate to support you while you're delivering. According to Dr. Sears in his book, The Birth Book, less rates of cesarean section and shorter labor and less medical intervention has been noted by deliveries with doulas. Second, Communicate with your midwife or your doctor your desire to breastfeed. Let them know ahead of time. Number 3, if you are delivering at a hospital, choose a baby-friendly hospital. Number 4, create a birth plan and include skin-to-skin and initiating breastfeeding within the first hour. Number 5, seek lactation support early. I encourage everyone to take a prenatal breastfeeding class, have a prenatal consultation with a lactation professional, and seek help if any concerns arrive after delivery. Additionally, discuss any breast abnormalities or concerns with a lactation consultant prior to delivery for that additional support. Most birth plans have 4 main sections. So you have a request before birth, requests during labor and delivery, vaginal versus C-section, discussions and preferences, and then requests right at newborn care. Birth plan templates are readily available online. Dr. Sears, in his book, The Baby Book, is also a great resource for expecting mothers. When discussing your requests before birth, understand how birth choices can affect breastfeeding it's very important. For example, induction and assisted labor may affect breastfeeding and should be thoroughly discussed with your healthcare provider. You definitely want to inform hospital staff that you plan to breastfeed. When discussing your request during labor and delivery, be sure to include holding your baby skin to skin and during the first hour. Vaginal versus C-section birth preferences, definitely consult your medical staff. Note, however, that mothers who deliver their babies via C-section can still have successful breastfeeding journeys. In the section regarding requests for newborn care, be sure to include keeping your baby in the same room with you, or known as rooming in, and the limits of pacifiers, artificial nipples, and or formula unless otherwise medically indicated. To ensure a great start to breastfeeding, your plan should absolutely include skin to skin. Holding your baby skin to skin reveals its own set of magical properties. It helps the baby transition naturally and get organized. They can hear your heartbeat and smell you. You are comforting to them. Skin to skin regulates babies' body temperatures, so much so that a mother doing skin to skin with twin babies can have breasts with 2 different temperatures, one to accommodate each baby. Skin to skin reduces uterine hemorrhaging. We know that colostrum is present during pregnancy, but skin to skin helps that transitional milk to come in. This is also when non-nutritive nursing occurs during skin to skin. Remember, breastfeeding is so much more than milk, and babies nurse when they need comforting, when they're anxious, for a host of other reasons, other than just being hungry. Your baby will show feeding cues during skin to skin. And dads can help with skin to skin as well. This is particularly relevant if mom has had a C-section, for the NICU babies, and even during a home birth while the placenta is being delivered. Obviously, not everyone can breastfeed baby, but our support team may still be very excited to help out and even bond in their own way. We will now talk a little bit about how to engage your postpartum support team. Fathers play an integral role in a mother's decision to both start and continue breastfeeding. You should prepare your family and friends for your breastfeeding journey. So they can be supportive in several different ways. They can take classes with you. Prenatal breastfeeding and birth preparation classes are not just for the mothers. This can really allow postpartum support people to be informed on what is happening with you and your body and how they can best support you. They can bring you water and snacks while you're nursing. They can take care of the chores, laundry, grocery shopping, help keep you comfortable with heating pads, pillows, footstools, etc. Additionally, they can tend to the other children. If you are pumping, they can definitely clean and sterilize your pumping material. Creating a breastfeeding playlist or movie list, Netflix list. They can absolutely change diapers. And they can have a lactation professional's number programmed right in their phone for easy access, just in case you need extra support. And my most favorite of all on this slide, they can always tell you how beautiful you are each and every time you nurse. I wanted to include a slide in here just touching briefly on addressing breastfeeding doubters, because you will inevitably run into somebody who may have some doubts about your breastfeeding journey. You should remind them of the many benefits of breastfeeding to both mother and baby. Remind them that baby needs to be close to mom. This is natural, this is important, and it's relevant for emotional, physical, and intellectual development. Remind them that breastfeeding facilitates bonding between a mother and child. Breastfeeding is both natural and hygienic, and at the end of the day, it is your body, your baby, and your decision. Okay, so let's talk a little bit about employee breastfeeding rights. We want to make sure that you understand your state laws and understand your company or your school's breastfeeding guidelines before maternity leave. As of 2018, all 50 states offer some type of legal protection for nursing, though there's a lot of the specifics vary from state to state. TheBump.com maintains a list of those laws by state. The Fairness for Breastfeeding Mothers Act of 2019 requires certain public health buildings to provide a space for mother's milk expression. The Affordable Care Act requires private health insurances to provide coverage for breastfeeding. This includes supplies like breast pumps, as well as the cost to see a lactation professional. According to the U.S. Department of Labor, employees with at least 50 employees must provide the following: a reasonable time set aside for employees to express breast milk for a nursing child. And note, this is up to 1 year of life. Unfortunately, employers are not required to compensate nursing mothers for these breaks. The statute also specifically states that the room should be shielded from view and free from intrusion from other coworkers. A bathroom is not sufficient. Before you take maternity leave, know where you can pump and/or express your milk. Many employers and schools offer mother-friendly rooms. This could also just simply be a private office. Research breastfeeding childcare providers, breastfeeding-friendly childcare providers. Consider childcare providers close to work or school so that you can easily slip away to feed baby and then return back to work or school. Also, consider going back part-time or maybe even ramping up to full-time. You should definitely understand how to store and handle your breast milk safely. This could be easily discussed with a lactation professional, or you can also rely on information on the CDC in regards to breast milk storage and handling. In review, as you are preparing to breastfeed, remember breastfeeding has many benefits to both mother and baby. I encourage you to attend a prenatal breastfeeding class. Choose a birth team who supports breastfeeding. Hold your baby skin to skin and keep your baby with you. Avoid pacifiers, artificial nipples, and formula unless specifically medically indicated. Otherwise, observe your baby's feeding cues and nurse on. Get comfortable, get relaxed, and be sure to always accept and/or seek out help and support when needed. When to call a lactation professional. If you have known breast abnormalities, such as a breast reduction or implants, inverted nipples, or have experienced breast trauma, contact a lactation consultant prior to giving birth. Once baby arrives, if you are experiencing nipple pain, latch issues, if you have supply concerns, or need some guidance in going back to work and planning to pump, definitely reach out to a lactation professional. I would like to thank you for your time today and your attention. I hope that you found this workshop beneficial in helping you prepare with your birth team and your postpartum team to achieve your breastfeeding goals. I have included my contact information here on this slide. I hope that you stay in touch. Thank you.